Welcome to the Informed Mom Podcast with your hosts, Jessica Humer and Angie Rosenberg. The Informed Mom Podcast strives to tell real mom stories about their experiences of motherhood through pregnancy onward, covering topics such as complications during pregnancy, miscarriage, C-sections, breastfeeding, postpartum care, relationships, sleep, and raising baby, to name a few. Join our community of moms and experts as they share their journey into motherhood.
Welcome, everybody, to the Informed Mom Podcast. We are so glad that you found us and that you joined us here today. This is Jessica, and I am here with my co-host, Angie. And our guest for today is Dr. Marlene Kalouyan, our favorite OBGYN, who is a regular guest on here. And we're going to be talking today about vaginal changes after childbirth and what vaginal rejuvenation actually is. And there is a lot to discuss. But before we dive into our topic, we always start with a win and a fail, basically because nobody has it all together. So let's just talk about what's going on in our lives and, be honest and open, and it's all good. So Ange, why don't you start us off?
Sure. Okay. So last night, I'm starting with my fail. We went out to dinner with our family and I ordered some sake, and, they serve it with those cute little glasses, right? So my son, of course, wanted the cute little glass for some water, which is fine. And so did our cousin. And so we gave him these cute little glasses. Well, so we're sitting there and I'm like busy holding my baby in the high chair and trying to also manage feeding everybody. Winter took a sip of the sake. So that is my fail. I felt so bad. I think there was like this much, just a teeny bit left in it. But I was like, oh my God, did you just drink that? And Mark is like, he's drunk. He's drunk. And I'm like, he's not drunk. No, like, it's fine. He's fine.
Do you like it?
So, I feel like it tasted like juice because it was like grapefruit flavored and like,
oh yeah.
Yeah, I know. And then he was acting a little wild because he knew he did something he shouldn't do, but he was totally fine. And there was like nothing in there. So anyways, mom fail. I'm sure other moms have maybe hopefully done something like that, or maybe I'm the only one. I have no idea.
That's awesome.
Yeah.
Is it bad that I've offered a sip?
Your child?
Yeah, I was just like, hey, go ahead. Like,
entices them more. Mm-hmm.
It was a
It's
cute
okay.
little
It's not a family.
So my win is sleep training my daughter Eden. I feel like I talk about sleep all the time, but like it's because it's such a thing in my house right now. We started last weekend. She's doing great with it. But we need to work on middle of the night wakings now. But anyways, laying her down sleepy but awake, and she's doing it, and we're there, and I'm happy about that.
Killer. Dr. K, do you have a win and fail or for this time?
I do too. So last night actually was a night that involved hanging out with a lot of Darla's classmates. Actually, her classmates and her parents, the parents of the classmates. These are considered good friends of my daughter. And there was some responsible drinking in our house, and which led to going past bedtime, significantly past bedtime. So there's a lot of paternal, maternal guilt being hovered around. But by the end of the night, the girls, turns out, were organizing a talent show. And they put on the most amazing talent show a 6-year-old can put together. And not only that, but my daughter orchestrated it and showed some significant empathy, because one of her classmates or friends didn't want to participate. She knew exactly when to reel her in. So I'm going to admit that at midnight, my 6-year-old was up, like performing a talent show, and that's a huge fail, but a huge win, because she has lifelong memories in that video and showed such empathy towards her friend. So huge win, all at the same time.
I love it.
Wondering though, yeah,
I love it.
We walked away forgetting all about the guilt of letting them stay up past their bedtime, and it was so worth it. Worth every like painful moment I'm feeling right now.
My win is that Hunter took his first step. So that's huge. He's 17 months, right? He's a late walker, and he's not like walking around now. It's not like overnight. He's like, oh, I'm going to run.
Yeah,
like
but he took the courage moment. Yeah.
And it's so fun because when he does this, he's cracking up. I mean, the biggest, goofiest smile. He thinks it's so cool that he's standing, he's laughing, and it's killer. Like these moments, I'm like, you're a walker. I think I'm freaking out so stoked. And yeah, so that's my win. My fail is pretty generic. I feel like my time management skills these days are garbage. And trying to I feel like I'm never actually getting anything done. So then that funnels through into, everything else where it's like for Hunter or for my husband or whatever, where I feel like, I never got this done. So this time is not as focused because I'm thinking about all the other things I still need to do and whatever. So that being said, one of the things that I do want to mention is if anybody out there is good with social media, I could really use the help because I don't have the time or mental focus to work on the Informed Mom podcast social media. And I feel like we have so much good stuff out there that would really help women. But, we need to spread the word. So if anyone is interested and has any kind of skill or interest in the social media world, please reach out to us because I would be ever so grateful. Yeah. So that's that. So should we launch into this episode on vaginal rejuvenation?
Let's do it.
Okay. Today's episode is twofold. So we're going to be talking about physical changes down there after birth and how best to address them. And we're also going to discuss vaginal rejuvenation, which is so taboo. And I'm pretty pumped that we're going to kind of talk about this because everyone always kind of either cringes or feels a little uncomfortable with it. So that's why we're talking about it on this podcast. So we're going to have a separate episode about Kegel and pelvic floor exercises with an expert in that area. So you can look forward to that. But today we're going to touch on so many things, and that includes the use of lasers. And I know some people are against lasers and energy use devices for one reason or another, or just not knowing about it. But not me. At the risk of oversharing, I discovered vaginal rejuvenation totally by accident, and it's the greatest gift ever to me, ever. So I'll explain that in the episode. But I wanted to preface the episode by saying that the FDA does not approve lasers for vaginal rejuvenation, and we'll discuss all of that. But each person has their own unique concerns. So talk to your medical provider about what's best for you. And today we're going to talk to Dr. K, who at least can inform women out there of their options should they decide to go that route, which is awesome. So with that, Angie, would you like to introduce Dr. K?
Yes, I'd like to introduce Dr. Marlene Kalouyan. She is a board certified OBGYN based out of West Hills, California, and we regularly refer to her as Dr. K. And she is a well-known in the women's health community for her exceptional level of care in the last decade. She delivered Jessica's son, Hunter, and has been a guest on our podcast many times. So we'd like to thank her for coming back and helping us digest this topic today. Please feel free to pass this on to your mama friends because we are going to address a lot of things that women often don't talk about, and it could help your mom friends. So first off, if someone has a natural childbirth, what sorts of changes to their vaginal area can they expect immediately after and long-term?
Okay. I think what we can do is break this down to functional and aesthetic changes. Because that I think will then dictate in understanding what really we refer to as vaginal rejuvenation, which is really just a broad topic. And by the way, thank you for having me. I appreciate the time too. All right. To answer your question, immediately after birth, it depends upon how the actual birth process for the patient is. Birthing itself can involve either having a minimal amount of tearing or none. A range of outcomes. And when we say tearing, the labia, the vulvar tissue can tear, the actual vagina walls can tear, the perineum, which is the space between your vagina and the rectum, can tear. Certainly the rectum itself and degrees of that can tear. And we have labels and degrees that we associate. So tearing and restitching is a common element, especially if it's after your first birth. And so having immediate recovery from stitching that's placed in various degrees in your body can have its own sort of pain process. Swelling from just pushing alone Then comes the functional element. Some people may or may not have this immediate lack of control over their bladder. They may feel as though their bladder really only tells their brain that they have to go at the time of leaking. They're already leaking onto themselves before they even get these signals for urination. And that is alarming to many if they haven't had that pointed out and they feel like it's a permanent change. But most often, within the few months or weeks after the delivery, that's something that people can recover from. But long-term changes then can settle in, and you may not witness that until maybe at least 6 months to a year after, where you start to see that maybe I did regain some bladder function, but it's not really how it used to be before the delivery, to the extent of maybe just having the urge to pee more, where you just feel like that bladder doesn't stay as quiet as you would like, and you feel the urge to urinate and void a little sooner. And that might happen during the day or at night. It makes you up a little more. And this is past pregnancy. We no longer have the baby sitting there. And we're just getting more often these signals. So the urge to void, or of course, the most common complication, which is what we call stress incontinence, where you urinate when you have actual pressure that's, not the normal amount. So which means when you laugh a little, you may leak. When you jump a little or exercise, you might leak or cough. And these are things you didn't have before, or maybe just experienced when you were pregnant. And so that would be sort of the urologic functional changes. Then comes what we call coital laxity, which is a very difficult and uncomfortable discussion that has had with patients, because to bring yourself to say what coital laxity involves telling a friend or your physician that, for lack of better words, your vagina doesn't feel as tight as it used to be. And usually that's sensed when the patient, is attempting intercourse and just it doesn't feel that snugness, we can call, of their vagina while they're having vaginal penetration. This sort of looseness that they will sense, or sadly, if their partner points it out. So there is an element of your vaginal canal widening and loosening to the point of feeling like sex doesn't feel the same. And that's a very uncomfortable topic for many women to bring up. And this is not saying that every single person will have a degree of all these problems. Many people can walk away having none of these issues whatsoever. But having changes in how sex feels, whether it's painful or lack of feeling, coinciding with the urologic changes are probably what I would classify as functioning issues, how the function of the vagina, how it feels. Now, of course, that's, contributed by the actual anatomical changes, but functionally, the vagina doesn't feel the same. Urologically, it doesn't feel the same for some people. And then, of course, the overall look of it would be determined by how the stitching ultimately healed. I have several patients, not countless patients, who may not have any vaginal tears, and their vulvar tears was where I had to piecemeal the stitching together, and it may not heal perfectly, where now they have these indentations and ridges along their vulva that just seem to aesthetically bother them. Or their perineum seems to be a little, again, for a lack of for just me using more common terms, what you would refer to as wrinkly. Where we would say there's more skin laxity. So the skin of the perineum, you may think, is something you never even think about because it's usually pretty flat and inconspicuous. But if it's stretched out and we have this looseness of skin in that perineum, people can oftentimes mistake that as hemorrhoids. And it's just a gathered fold of skin that wasn't there before. And it becomes a huge distraction, because now women are, for the first time, really paying attention to how things healed, and they're realizing maybe anatomy that was already there or wasn't there. So lots of aesthetic and functional changes that I can continue kind of to delve into. But these are things that for various degrees can occur. And if women aren't informed that these are common, to not, of course, be alarmed, And also then to be told that there are hope in, in varying degrees for all of these, I think is uplifting and in a way of an anxiety reduction to understand that you don't need to, well, one, changes can happen, but two, it's okay to discuss them because there's help for all of these, and being informed about that is a powerful thing. So people aren't as afraid of vaginal birth.
I think also removing that element of shame.
Absolutely.
I think people are scared to talk about these things, even in a doctor setting or just in general, because they feel like either something's wrong with them or whatever. It's just not talked about. But it's like, ladies, there's so many different things that can happen in childbirth or after or whatever. And, we just want you to feel good. And so anything that we can do to talk about these things should be talked about so that you can enjoy, all the pleasures of life again.
Absolutely.
No
and the term vaginal rejuvenation really, I think, refers to addressing any one of these issues and how and whether it's with surgery or lasers or any other or medical treatments, there is help for all of these various issues. So in your case, Jess, for example, the use of lasers can be for various reasons. Okay, for some people it could be for pain that they've experienced just from the way the stitching has healed. For others, it could be just this sort of loosening effect, and we can delve into how lasers could work in having a tightening effect. They can improve mild urologic issues. So lasering can serve to rejuvenate the lining and maybe even the muscular tone, but that again deserves its own discussion because I know it's a controversial element here. But then there's also the surgical intervention. Some people's, what I forgot to mention is some of their labia grows. Sometimes it just becomes hyperplastic, we say. It can double and triple in size from the hormonal effects of pregnancy. And you have these huge vulvar area that becomes an insecure point. People can see them through their bathing suits, for example. They get a bulge that they didn't have because the tissue is overgrown. So some people's vaginal rejuvenation could be just reducing surgically those vulvar tissue. And for those others, it could be, doing what we call an anterior posterior vaginal repair. It's an actual urogynecologic procedure that can tighten the walls again. And that's its own surgical intervention. We can delve into that. But so rejuvenation is to address any one of these issues with alternatives, but again, you have to first understand that these are problems, and you can share with them, you're a practitioner, and then you can have a detailed discussion about how to do it.
What about somebody though who has a C-section? Are there changes that they may experience in the vaginal area after childbirth that way?
Good question. C-sections oftentimes don't tend to immediately feel the effect of childbirth because there's not trauma going through the vaginal canal. But what they can experience either, from their first, but oftentimes after their second, is the urologic changes, just from the cumulative effects of having one or more than one shot, like actual pregnancy, can shift where the bladder sits. And so they've seen actually that pregnancy alone can contribute to bladder changes just from the experience of holding and supporting a child with your pelvic floor. So those women may not be as subject to some of the details that I shared of changes, but it certainly can feel those urologic changes over time. And that's something that is relevant, despite having a C-section. And then, of course, issues that may come along with their scar. And that's where there's overlap with the lasers that can help both types of patients.
There's so many things that we could really, so many different directions we could go off, because I have so many questions coming up, but we'll just stick with this first. And then if we have time, we'll continue on with the discussion. This might be a 3-part episode for all I know.
Yeah.
So one thing I do want to address is that first week after childbirth and the at-home care that most ladies need, especially with the, vaginal childbirth. Prior to having my son, I didn't know what to expect or how well to prepare. And I just want to say thank God for my friend Blair, who sent me some supplies beforehand and got me thinking about the healing process. But honestly, it's not something that's talked about openly. And on a side note, I feel like that's one of those things that for every baby shower, everyone's giving baby clothes, but we should be giving the mama postpartum care supplies, because
Absolutely.
I mean, this is something that can be traumatic. Even for me, I did not have a traumatic childbirth, but still, there's healing. This is a big thing. So what sorts of supplies would you say a mama should have on hand to help her vajayjay heal
Mhm.
best?
I think one of the best comforting and healing approaches to have would be two things. One, to have a nice big bag of Epsom salt. And Epsom salt, there are essentially magnesium salts that can be placed in a shallow, bath of water. Sitting and soaking in that after birth can be very soothing and healing to anybody who's had repair there in the vulvar and perineal area. But even more helpful and practical than that would be to have we call pads, but I suggest to people getting the Depends underwear, which has the pad and underwear all woven into one. So you don't have to worry about putting a pad in your actual underwear. You have this disposable underwear that serves as a pad. And on there, you can soak into the vaginal area a solution that you can make yourself, or one that they now have seen sold under different brands. But it's a combination of witch hazel and lavender oil and some aloe vera. So all having really nice anti-inflammatory soothing effects. But what you can do is pour that solution onto the perineum, place it in the freezer, and you've made little pads for yourself. And you can wear that pad as an icicle, as an ice pad to soothe you, or just as your pad to soak up, obviously, that normal bleeding that can happen for weeks. But I suggest people do this the first couple days. It's a nice cooling element. It accelerates healing and decreased swelling, and it's nice and comforting. So that's what I would tell people to have practically on hand.
You just said that there's a normal amount of bleeding for a few days or weeks. What is a normal amount? Because that's something nobody talks about.
Right. So the overall pattern, I'd say, is the first 7 days can be the heaviest, where if you can think of, how would we define heavy? You can be changing a pad every hour, and that would be considered normal, as long as you're not soaking through the pad with, palm-sized clots, and it's not being soaked through and drenched. So it depends on, obviously, how comfortable you want to be with how soaked the pad is. But I'd say on average, a pad every 3 to 4 hours the first couple of days is normal, followed then by maybe having to change your pad 3 times a day. It's just trying to give you a number. But what is really considered normal is to have light bleeding that would entail having either a light pad or a panty liner for weeks, up until 6 weeks postpartum. So expected a heavy amount of bleeding the first week, followed by medium to light, to then brown discharge over the span of 6 weeks is what we consider normal. Heavy bleeding the first week, where you should call your physician, would be if you were soaking through 2 pads every hour for 2 hours straight, where you're also passing a fair amount of clots during those 2 hours, would be a reason to call. That would be the extreme for when you've gone beyond what's normal.
And if that happens, what's going on?
Several things. It could be your uterus just decided to soften and not be able to maintain the tone, with a muscular tone, to allow that sort of deficit that was left when the placenta left. It's a physiologic change that needs to happen, where the uterus just sort of cramps down and maintains a muscular tone to close off all those open blood vessels where the placenta detached. And sometimes it just loses that tone for no reason, and it starts to bleed. Some people think there was a clot there that was helping to sort of compact that deficit, but the clot may come unlodged and then open the gates for bleeding. Sometimes there's tiny little wisps of placental tissue left behind. The uterus is so delicate and sensing something that shouldn't really be there, and its way of trying to expel it for you is to bleed. And sometimes it can actually do that. It'll release any of those little membrane pieces that your doctor or nurse tried to do their best to clean out, but there's some areas that the body just has to help with. And it can do that either with a heavy gush of blood that you never even realized it was trying to do, or with continued persistent bleeding that you now may need a medical or surgical intervention for. Yeah, so there's different reasons for why you need to bleed heavily, but all in the end, the patient just needs to do is let their provider know when it is happening more than usual.
Can we switch to directions a little bit to talk about sex? Because you said, first of all, the 6-week mark is, it may bleed for 6 weeks, whatever. Well, so when it comes to sex, it's recommended that women wait at least 6 weeks after childbirth, and that's based on a lot of factors, right? So one, why would someone wait longer than others? And when do they know when it's the right time physically, not mentally? We're not talking about mental because women have other issues with that, to start having sex again.
Right. It is this arbitrary designation we give 6 weeks, but more or less, 6 weeks is on average the length of time it takes for most of the stitches that we use to dissolve and have this tissue remain in a way together that won't be compromised with any friction. And that's roughly the amount of time it takes. Now, some people, if I were to examine them 3 to 4 weeks after their delivery, they may be ready to go. And then there are those that are told you have to wait a few weeks longer based on how it presents themselves. So just know that it takes roughly about 6 weeks for all the stitches to dissolve, which, by the way, no matter where you deliver in this country, I don't care who delivered you, I'm going to go out on a limb and say it's always dissolvable stitches at the time of a vaginal delivery. So in case you forget to ask your provider, just assume it is absolutely dissolvable. So you technically won't need to see anybody to remove those stitches, but you'd be surprised the degrees of healing. There are people who I won't even see one stitch left by the time I'm examining them. And I'm really just seeing how the tissue came together. And then there are those that have several that they may need help to have removed. But that's where the arbitrary number is the average length of time it's going to take for all those stitches to disappear and for the tissue to finally reveal itself of how it's finally going to look. And then based on that, we do the exam and decide, are you ready to go back to normal use? Or do we need an intervention? Or would you just need a little more time? One of those three will be told at the time of the follow-up visit.
And by the way, ladies, we're going to have a whole other episode on libido and sexual desire too, because there's a lot of things to discuss there and tools that can help. And nobody talks about any of it. And we don't want any woman to ever suffer in silence. So we're going to be addressing all those different things at a later time. So,
yes.
Well, let's continue. What about dryness? Why does vaginal dryness happen? Do moisturizers really help? And any recommendations?
Good question. Vaginal dryness is one of the most common issues, regardless of whether someone had any stitching or any repair done. I would say the most common reason is going to be actually related to breastfeeding. So when you're nursing, the hormonal shifts that allow you to actually have milk production involve having a low estrogen state. It's just a physiologic byproduct of nursing. You live in an estrogen low state. And for some people, it's low enough where it can actually hinder the glands in our vagina that lead to lubrication and moisturizing. So it's such an issue that we actually the remedy for it is the same topical estrogen that I provide for my menopausal patients. And I tell them temporarily you can use this estrogen cream that will not be absorbed at levels that would in any way interrupt nursing. So you can continue nursing, but just spot treat the issue, which is to provide estrogen to the vaginal wall so that it can resume its own natural moisturizing effects. Some people, a lot of women may not even have to resort to that. We just sort of have to acknowledge that it's a temporary dryness issue, and maybe just some lubricants can bypass the problem. So not everybody's going to need to have a prescription estrogen topical, but we may have to use that temporarily until they're done nursing. So that's the most common reason for why someone would be dry. Then I usually just lump up everybody else into the pain category. If you have residual pain that you didn't have before you delivered, oftentimes that's going to have a negative feedback psychologically on, to you and ultimately your body, and you're going to tense up and obviously not be able to enjoy as much as you normally would. And then, of course, when we're psychologically distracted by pain, or obviously babies too, but anything that's going to be distractor, which pain is obviously a huge one, it's going to lead to dryness as well. And so we'd have to just address the pain, to get to the treatment of the dryness.
Is there anything that a woman can do before childbirth to prepare for maybe better healing or maybe not experiencing these things?
Yeah, this is by far one of the most important questions I think we should tackle, because I have had this before, been asked. And let me tell you, when you look at the data, none of the research, unfortunately, lends itself to anything significant that you're doing that you can change the outcome of. Okay. There is a lot of talk on the internet about using several oils and massage elements and stretching approaches. And I'll tell you, if any one of those techniques had actually been shown to make a difference, I'd be the first to tell people this is the responsibility you have. We can even have a discussion of how you may cause more problems, logically, by attempting to massage the perineum unnecessarily, because now you can create more swelling that could lend itself to more tearing. The degree of tearing and outcomes is dictated ultimately by the baby's positioning, how long and how hard a patient then had to push, obviously size, position of baby, and then the most important part, which you can't also control, which is the integrity, the thickness, the way the actual tissue is, and that's just pure genetics. How much elasticity and collagen your skin has all over your body is ultimately dictated by, yes, lifestyle, but genetics, especially the vaginal area. You can't use sunscreen to protect the integrity of your vaginal walls. Taking collagen won't necessarily, we love the use of collagen. We can go on about that, but that won't necessarily make your vagina more elastic if that's already been dictated by your genetic profile. So to answer your question, there's nothing you can do beforehand. And so let that be one less thing on your to-do list while you're pregnant.
Love it.
Then, yeah. You just really have to just share the problems after birth and then, tackle it that way. One less thing to do is nice to hear about, right?
Yeah, exactly, because I wasn't really doing that too. And I remember some of my friends were, and I was like, oh, but my failing in that department. So, hey, it's one less thing to worry about. Can we talk about pelvic floor exercises versus laser therapy, and just kind of, do you want to go into that?
I will briefly. I will, because it is kind of talking about the topic of treatments for urologic issues. But let me just say that whether you pull up data from the 1950s or current data, there's always going to be improvement in the vagina with pelvic floor therapy, which basically is also as vague as vaginal rejuvenation, but maybe not as much. So pelvic floor therapy involves or refers to any effort, whether it's someone external that's a designated pelvic floor therapist. These are physical therapists specializing in pelvic floor work. So whether it involves actually seeing a human that can guide you in those stretches and exercises, or whether it's a gadget that you've purchased online that has its own sort of several categories in how they can use technology to guide you, or whether it literally involves thinking of certain muscles that hold the act of urination and just squeezing and releasing them. Any one of those have been proven to help with outcomes in these issues we've talked about. Not the aesthetic part, but the functioning part. Now, the debate will go on about to what extent are each going to make a difference. And that's where the research still is continuing, because everybody has different degrees of problems as they start that journey. Every woman has different levels of commitment. So it's very hard to take a human enrolled in a trial and to say, go home and do this and that, and then assume that they're all going to do it at the same pace and consistency. So when you kind of stop and think about all the research that has to go into cultivating humans into this model and then trying to tease out what they benefited from them, really hard to standardize everybody. But the work is being done, and I feel like we've had leaps and bounds and improvements in understanding what's helpful, more helpful than not, and then discussing honestly the time and the financial commitment that comes to these approaches. But yeah, to answer your question, Kegels or anything that's going to help doing Kegel work is going to help with functioning outcome, and people should appreciate that so that they don't have to always feel like surgery or expensive interventions are the only way out. You can truly work on it on your own as well, and we can discuss what those mean another time.
Yeah, so let's just get into lasers then, Jess, and we want our listeners to know what options are available and which are effective. So would you be willing to share your story a little bit?
Yes. So I discovered this. Dr. K is my hero for so many reasons, but my deal is I waited the recommended 6 weeks to have sex. My birth was actually good. I had a very positive experience. I didn't have tearing, but I had the one stitch, which dissolved or whatever, and I healed all in all nicely. And so I waited the 6 weeks, and it was the most painful experience of my entire life. It was so traumatic. I was shaking. I was crying. I mean, it was awful. And I went to Dr. K and I was like, this hurts. Like, what's going on? And she went in and she took a look and she said, you've healed absolutely great. But what didn't heal is the nerve endings inside.
Mm-hmm.
So even though I'm healed and everything looks how it's supposed to heal or how it's supposed to be, my nerve endings weren't right. And she said, "Oh, I can take care of this in a second." So the next day, I knew I was going in for a laser. I didn't know anything about it. I like I said, I don't like to prepare. I just like to do. I jump in. And so when I got there, the lady's like, "Oh, you're doing Mona Lisa, okay?" And went into the room, and I was like, "Oh, I'm doing Mona Lisa therapy." I'm Googling it while I'm waiting for Dr. K. So first of all, you can do this treatment and she can explain it more up to 3 times. So she did it for me the first time. I have a very high pain tolerance, so I didn't even really feel it. I was like, okay, but my legs were like twitching. So obviously there was pain, but I didn't really feel it. And she had it on a very low setting. And she said, okay, wait a couple of days. And a couple of days later, I had the sex with my husband, and I texted her and I was like, holy moly. Like, I felt like I was 18. I mean, it hasn't felt that good. And it's like amazing. Like, it was a gift given to me. And I said to her, I said, wait, if I do it again, does it get better? And she said, yep. So I did it again. The second time around, she bumped it up quite a bit. And I felt like, oh my gosh, am I like on fire down there? It was a little slightly painful, but honestly was worth it because I mean, I didn't know that sex could be this good. And it's so interesting because it's the same thing. You know what I mean? It's just whatever happened was tightened or fixed or whatever. And I want you to explain the whole Mona Lisa treatment because a lot of my friends have talked to me about this and they said, gosh, I'm dry or I'm this and it hurts. And sex shouldn't hurt. And it's like what Dr. K said, if it does hurt, why would you want to do it? And I think that causes a lot of relationship issues, a lot of things. And that's why I was like, even though this is slightly uncomfortable to talk about, I mean, God, see me on the internet. Whatever, like girls, ladies, this thing actually exists. And I want you to talk about it so you can help all the mamas out there. And yes, it's controversial, but whatever, dude. I'm telling you firsthand, saved my life and really helped my relationship because it's awesome.
Absolutely. Okay, let me explain something. And it is dense, but I'm going to try to keep this simple. There are several types of lasers out there, and it's almost mind-boggling how many different brands and companies there are. But for anybody that's going to attempt to look into having one of these, the best way you want to approach it is to actually pause and ask someone, what type of laser is it? Not just the name of it, because Mona Lisa is one company that makes the CO2 fractionated laser. There's several others. Mona Lisa doesn't have to be the only one. So the types of lasers that are the most commonly used ones that are used for the vagina are the CO2 fractionated lasers, okay? And then there's radio frequency lasers. There's several others we can get into, ultrasound therapy lasers, and then there's ones that are YAG lasers. People may have heard about IPL lasers. Every laser has some degree of element of healing skin and muscle, but some will have more efficacy depending upon how deep they can penetrate and what the outcomes are. So the most commonly two that are used is CO2 fractionated and the radio frequency. If I could generalize what my impression of these lasers do would be the CO2 fractionated one, which is Mona Lisa, which is what you did, Jess, is really helpful to people who may have pain issues, dryness issues, certainly, and to some degree, pretty mild urologic issues. Radio frequency lasers can be extremely helpful for people that have leaking, sort of urologic incontinence issues, some laxity tightening issues. But again, there's some, like I said, there's overlap between the two. Why is it controversial? Because these lasers, first of all, let's understand that they were developed initially on the market for skin healing, whether it's from wrinkles or burns or actual areas of the skin of the body outside of the vagina. And then it's only been in the last decade or so that they've used that technology to find these, to use these probes or appendages that actually are used for the vagina. And so the data from the skin is just being gathered. And now so what we understand can be improved in the skin of the outside of the body can definitely be generalized to the vagina. But because it's up and coming technology, that's why you can still pin holes in the research that's coming along. And one of the easiest is, well, the number of participants in the trials may not be as great. Again, that's because anything that's fairly new on the market it's going to take time to integrate into these academic centers and non-biased, company-funded research that's going to really demonstrate the effects of it. And so that's why it's controversial, because fairly new technology that is on the market, even though it may not have an FDA indication for that use, but it's not illegal. There's a reason for why it's heavily utilized, because we're seeing in real-time benefits. And ultimately, we're going to have the research, I think, validate what we're seeing in clinical practice. But to sit and poo-poo or question the technology in the vaginal realm would be questioning the technology and its effects in the skin, the rest of the body skin realm. And there is overwhelming data there that supports that there are absolute benefits to using lasers to supplement your practice or to help patients. And so because it's been used longer for skin, that's why there's more data there. But that's going to trickle down to the vagina, and that's my belief, in my opinion, I'll admit that. But when we get into, if we have another episode, and we should, about the actual technology, I can present the current data that can support that there's clinical proof to the use of them. But the most important thing to discuss today, honestly, one of the most important isn't just that they're helpful for pain and laxity and urologic issues, but it's also that it's there, it's available. You discuss whether you're a candidate for it, whether your practice, your provider has it, where they can refer you to what they believe is the appropriate laser for your problem. And then ultimately the financial contribution that comes along with it. Because ultimately it's not covered as of yet by insurance.
I want to go back, listen, ladies, and say again that sex should never hurt.
Right.
And you just did something amazing by bringing a little baby into the world, and birth is traumatic on the baby. It's traumatic on you physically. And so if this is something that you're experiencing, whether it's the incontinence or the physical pain during sex, or just the look and feel that you don't like anymore, please consider talking to your OBGYN and see what options you have available to you. So besides the laser, what are surgical and non-surgical treatments? What are these other treatments that are available?
Okay, depends on the issue. So if we discuss pain, that's a difficult one. I'd say there medically you can intervene with residual pain. There are some compounded topical treatments that weave in these neurologic agents. These are medications that people take for nerve pain outside of the body, and we can compound them into topical agents that people can apply onto the vagina and perineum. Now, I can't speak for the efficacy of this. Just again, it depends on the nature of what's causing the pain for this patient. Maybe the tissue is just brought together too tight, or maybe it was just a nerve issue for Jess. So it just depends on the story, but there have been cases where we can try to help pain by just treating the nerve pain itself with topicals. If it's a urologic issue, then you can have somebody be guided in either being sent to a pelvic floor therapist, or guided in how to do exercises at home. Usually I tell people to use some sort of guidance with a device, and there's several on the market. I can't speak for one in particular that's best. It just depends on, again, how much money and what the patient thinks is convenient for her. If it's a dryness issue, like I said, there's estrogen topicals or lasers. And lasers can be used for any one of these issues. There's any one of the problems we've mentioned can be addressed with lasers, but alternatives can involve, yes, either estrogen topicals, anesthetic topicals, or some sort of guided treatment at home. But it just depends.
Touch on one thing too, is I remember you had said that this technology that you used for the laser that I had was it was like approved for menopausal women or something to help with urinary incontinence and dryness and stuff. So that's also given it a little bit more credibility. Is that right?
Absolutely, yes. So the data that is very strong is the one that's come forth for why this came out on the market, the Mona Lisa. Ultimately, it was for atrophy, or what we call drying and thinning the vaginal tissue in menopause. And there is actual data that says by biopsy tissue, the differences in thickness, moisture that occurs pre and post procedure with a laser in menopausal patients. And so that was actual pathologic proof for how you can change the integrity of the actual tissue by eliciting your own body's ability to create collagen and elastin, and obviously also exfoliate and remedy any of the inflamed tissue or nerve areas. That being said, the crossover to postpartum became just ultimately logical use, because if you can elicit your body's healing efforts in the menopausal realm, why can't you apply the same technology for people who've had trauma or poor healing just for other reasons? And so to inspire body to heal itself can be used in different contexts. And that's where the crossover, I think, started to happen. And when you can clinically see outcomes of that over and over again, and I can speak for this because I have had several patients where I can tell you this without having them experience any bias. They didn't, when I've didn't practices essentially with a patient and said, let's try this approach without you having any sort of financial contribution. When I was trying to really convince myself how helpful this could be, I've seen over and over again how they will respond positively. And so one may argue, well, maybe they just convinced themselves because they had to pay a certain extent. No, that these are women who just had legitimate issues. And I told them, you're going to come in and not have any expectations. You're not going to be expected to pay or do anything. And we're just going to see how this helps. And so in my own sort of clinical trials, I've become a believer, not just because of the actual biopsy data and things that they use in other respects, but also in my own practice. And I can speak for the benefits tremendously.
And so can I. My last question is, why is it so taboo to talk about vaginal rejuvenation? Why do we feel an element of embarrassment, of shame to talk to the physician? Culturally, why is it unacceptable to discuss these things? Because I'm just kind of curious what your take is on that, and to discuss the equipment. How big of an investment is it? Do you think that hinders doctors from being able to maybe offer this as a solution?
Exactly. I mean, you touched on essentially all the nerves. It is difficult to have these discussions, number one, on a greater societal level, talking about wanting to enjoy sex, pain with sex, all sadly still pretty uncomfortable. I wouldn't say it's taboo, but there are still people who are very uncomfortable indulging in that discussion. Then comes the element of embarrassment when it comes to other functioning issues, not being able to hold your gas or having vaginal gas that you didn't have before. I mean, these are pretty still uncommon discussions that are had, especially in the context of just a physician-patient office visit. And so saying that I'm urinating on myself, or I can't seem to hold my gas in, or I'm even having fecal incontinence. I can't hold my poop in when I have to actually go. These are
that's a common issue after.
Absolutely. Okay. Maybe not as common as urologic issues. It's a little more less common, but certainly an issue that can happen. And I've had people who lived with it for decades and have yet to ever share that this is something they struggled with since their deliveries. So it's just not commonly discussed. And that's why I feel like anything that isn't, a normal topic day to day, like it would be if you discuss bleeding or maybe even vaginal itching at a gynecologic, visit. It just needs to be more standardized to just kind of explore these topics. And then what you said, the issue of when it is discussed, how are those words being met? Is the person that's listening to, is it receptive? Do you feel like you're heard? Are options really even being discussed? Are you just told this is just a fact of life? So honestly, levels of ignorance or the willingness from the provider's point of view to kind of explore these topics is also the issue that kind of hinders growth in that realm. And why? Maybe the physician just doesn't have the time in that visit to discuss this. And now we're inconveniencing the patient and saying, I can look at your vagina, but that's a whole other discussion and how it's making you feel come back. And now it's obviously an inconvenience because she's having to come back. Or if she does come back, what are the tools that doctor is taking the initiative to offer to her? It's a huge financial commitment for any practice to engage in having these lasers, whether it's one or two or more. It's an actual sacrifice the practice has to make in order to provide that tool, unfortunately, because where we are with insurance companies is they've yet to cover them. These are things that are out of pocket. I wouldn't have them in my own practice if I didn't believe in the technology. I had to convince myself first, but even with the sacrifice I make to have it, it's still a financial responsibility I'm having to carry with now, and in having to unfortunately tell my patient this is something helpful, but yet unfortunately I have to pay out of pocket for. So you see all these little areas that can hinder growth at the pace that we'd like it to be when it comes to this postpartum awareness, all these that will slow it down, unfortunately.
I think it all starts with discussing it. I feel like Absolutely. It all starts with putting it out there and kind of reducing that element of embarrassment or shame or feeling like, oh man, things aren't the same. It's so funny. I recently watched a Netflix comedy special with Nick Kroll, who's, by the way, so funny. And he talks about how, like, in society, we never talk about how we have diarrhea. Okay. Like you're not going to say I have diarrhea. In society, you're going to say my stomach's a little off. Right. And so he brings this up. We're cracking up because it's so true. There's just certain things that we will not discuss openly because of ingrained embarrassment. And I just want women to know that, like, look, there could be changes after childbirth. Maybe not. Maybe you're one of the lucky ones who just gets away scot-free, and that's awesome. That's so awesome. But if not, you do have options, and find a doctor that you feel super comfortable with, or even just like a friend. Like, talk to your friends, talk about these things, please, women, because life is good when things are addressed. Well, thank you so much, everyone, for joining us today. And I hope that this was beneficial. I do hope that you will pass this on to your friends, and even your moms and older women, because once I learned about the lasers and stuff, like Dr. Kalouyan said, it started with menopausal women and how it helped them. So I've been passing it along to older women, and they've all been really happy and thankful. So it's all just, just spreading some good info along. The way that we end all of our episodes is with a recommendation or a tip, a topic, or a tip, a product, a resource, anything that has helped us all personally. And so, Ange, would you like to share yours?
Yeah, sure. My tip today is kind of a product/tip. So, babies need sometimes, in addition to their pajamas, like an additional layer, right? As the seasons change and things start to get a little bit colder. So there's lots of different like sleep sacks out there that you can put them in. And sometimes I have found that you buy a sleep sack or something, it's got arms on it, just cut it off. If you don't need it to be super warm, just make it your own and go ahead and tailor that sleep sack. And that's what I've been doing lately with my daughter.
Awesome. What about you, Dr. K? Do you have any?
Yeah, there's ongoing efforts to try to get Darla still at 6 to have more peaceful nights. She still is sort of at the mercy of having these night terrors, we call them, these nightmares. They've improved, but we still struggle. But one thing I feel as though has really set the tone isn't just going to bed early or on time. It's actually these meditative practices, which are super simple. I've gotten her a crystal that is, supposed to be sort of a protective, relaxing element. And whether it works or not doesn't matter because she buys into it and she loves it. We use this lavender spray to spray onto our pillow. These sort of rituals that help us all relax have felt like she's more in control in her efforts to sleep. And I feel like it's decreasing her nightmares because she goes to bed with this peaceful mind.
Oh, that's awesome. That's fantastic.
Yeah.
My tip is there's, and we're still on the subject of a JJ. There's they're called Down There wipes by a brand called Good Wipes. And it's so cute because I don't know if you can see the little thing. You can't. They're these little individually wrapped packets that say treat your vajayjay like it's on vacay. Oh. And it's a shea coconut thing. It's flushable. It's biodegradable. And so, like, before any kind of like intimate time or just anytime you want to just feel like your vajayjay is on vacation,
I love that.
Legitimately, I love those things. So I just thought,
that's great to know.
Yeah, good to have on hand too.
Absolutely. That's great.
All right. Thank you, everyone, for joining us. Please follow us on social media at Informed Mom Podcast. If you're good at social media, please contact me so you can help me with that and we can get this podcast out there because you know what? I really feel like so many women would benefit. And we just appreciate each and every one of you. Hope you're having a great day and we'll see you in the next episode.
Thanks. Bye.
Bye, you guys.
Thank you, mamas, for being with us today. You can find us at www.informed-mom.com and at Informed Mom Podcast. To access our show notes, tips, and resources, simply go to www.informed-mom.com/notes. See you next time.